wish. But in this particular example, we use just a direct interrupted suture technique. And the third apex is now approximated. Deep sutures, if necessary, certainly can be utilized when indicated after adequate hemostasis is obtained. And once all these corner stitches are put into position, then the wound is closed according to the principles of halving. The Z-plasty is useful in lengthening wounds as well as reorienting the direction of scars. In this example, the central limb is 3 centimeters at the start of the incision. The limbs are the same length and both come off at approximately the same angle off the central limb. The angle varies anywhere between 30 degrees and 60 degrees. The greater the angle, the greater the gain in wound length. Any sharper angle or smaller angle results in risk of tip of flap necrosis, while a broader angle results in a difficult rotation. Here the flap is being held out of the way with a skin hook, and the skin is being elevated with a sharp number 15 blade. Each flap is then grasped with a forceps and transposed across so that the central limb totally reorients by 90 degrees in this example. The width of the defect increased from 3 centimeters to start with to 4 centimeters in result, demonstrating the lengthening effect of the Z-plasty. The corner stitches are placed into each flap first to transpose them. Remember, always transpose the Z-plasty. If it closes as it was initially incised, then it will have no effect. The limbs of the Z-plasty are closed with multiple sutures. A geometric broken line closure is utilized to break up a linear scar into irregular shapes so that they are better camouflaged, in that the eye has a great deal of difficulty following these broken lines and therefore makes the scar less perceptible or better camouflaged. The geometric broken line closure is really designed so that each side is a mirror image of the opposite side. Because of the toughness of the pig's skin, the geometric shapes here are accentuated, certainly larger than what we would perform on a human in scar revision technique. Here we can see the undermining, and using either a 15 blade or the scissors. Note the double hook, and third instrument, as it were, is the middle finger of the surgeon's left hand, while the scissors are dissecting using the tip upward technique so as not to cut any of the important deep structures. Once these tissues are well mobilized, then the surgeon will try to close the tissue by pushing the tissue together. Deep sutures can be utilized if necessary. There he's trying to close the tissues, and you can see we're now placing the sutures from apex, from peak to valley, and the tissues being well undermined allows the closure to occur with minimal tension. You want to close it with minimal tension to prevent widening of the scar postoperatively. And of course you want the edges to be everted. So a technique is utilized to make sure that these edges are everted. Now you can see how nicely, just with one suture placed, the wound is coming together. And that is because of the wide undermining. Again, the sutures are placed peak to valley, apex of the peak to the depth of the valley, and you can see how nicely this begins to close this pig's foot. The remainder of the sutures are placed peaks to valleys, and then according to the principles of halving. Here's a closer view showing the introduction of the simple sutures to close the geometric broken line closure as a technique or method of scar revision. Here we can see in this particular example the corner suture is being placed so that it does not interfere with the blood supply of one limb of the flap. There the corner stitch is put into position. It now comes out through the skin on the opposite side so that the closure can be made without interfering with the blood supply to the delicate tip where the incision had been previously placed. So there's an example of a corner stitch. And again, that is not necessary at every site. It can be used when you think there's a concern about the blood supply to the tip of the flap. That shows the conclusion of the close. W-plasty is a scar revision technique that's utilized to camouflage scars that are not parallel to relaxed skin tension lines. We use a geometric broken line closure when we have hypertrophic scars that are parallel to the relaxed skin tension lines. So here in this example we're using a W-plasty, and again the peaks and valleys are such that the peak on one side corresponds to the valley on the opposite side. The limbs of these W-plasties should not be any greater than 5 to 7 millimeters in length. The angles you can see are not less than 90 degrees. They're broader than 90 degrees usually, or at least 90 degrees. Now we're dissecting the W-plasty by now elevating the skin that's going to be removed, which would be the site of the scar. This is a little bit broader than we would use in the human because of the thickness and toughness of the pig skin. Undermining continues actually to remove the scar, and again W-plasty is used to camouflage a scar not parallel to relaxed skin tension lines. Now the scar has been removed. You can see the area of the scar, and now the tissues are well undermined. Again, either a 15 blade or a dissection scissors may be used with the tips pointed upward so that you don't interfere with the underlying vasculature and then have to obtain hemostasis. Now finger pressure is used to make sure that it can be closed easily. Deep sutures may be placed when necessary, and it's usually best to use deep sutures with a long-lasting life so that they are in position for a long time. Then eventually they may dissolve. This will allow the deeper tissues to be closed and keep the tension off the skin sutures. Here the sutures are interrupted, again from a valley to a peak, or from a peak to a valley at the apex. Corner stitches may be used. Here's an example of a corner stitch being used at this site into the dermis to prevent tip necrosis. They are not necessary in every case. And now the second throw is through the skin, and the suture is then tied down to close the wound. Instrument tie certainly may be used, or a hand tie may be used. Always use square knots.